They don't know who they are, who they're going to be today, what race, gender, or age. Today, we will be looking inside the lives of people who can't control their personality, spiral into depressive states, suffer anxiety-stricken episodes, and streaks of high arousal. Join us and grab your multiple masks on True Life. I have dissociative identity disorder. Jenny Miller suffers from dissociative identity disorder and was just diagnosed 6 months ago after 7 years of intense research.
I don't know who I am most of the time, and when I do know who I am, I just feel really depressed. I just feel like no one understands, and when I come into this personality that I'm in right now, the primary one, my doctor tells me I feel like I need to hurt myself, and I just don't feel like a part of myself.
Oh, I'm sorry, Jenny.
I have trouble sleeping all the time, and I don't know when the last time I got a full night's sleep was. Panic attacks hit me all the time while I'm sleeping, and sometimes I'll have extreme night terrors, and I normally just dream about like multiple faces are around me, and they all look like different forms of me, and I know that they're all me in my dreams. It's just like really annoying, and it's controlling my life. And did you see that? Did you see her? She's back again.
Who?
Sarah, she just bumped into you. I'm surprised you didn't see her. I talk to her when I'm really depressed. Sarah.
People who struggle with dissociative identity disorder suffer from frequent auditory and visual hallucinations. Sandra Hoff has been facing dissociative identity disorder for the past 10 years. People who suffer from multiple dissociative disorder don't just have alternate human personalities, but can have alternate personalities that take form in mystical creatures or animals. Sometimes she'll just be watching TV, sitting there, and doing her homework, and she just falls to the ground and truly believes that she's a cat. I don't know what to do half the time, because all she'll eat is cat food, and all she'll drink is water or milk, when she transforms into this alternate personality. When I talk to her about it, when it's over, she has no memory of any of it even happening. Today, Sandra will be going to see her therapist for treatment. Dr. Anders is the best therapist in the state and has thorough practice in the field of mental disorders.
Sandra is a patient I've been working with for the past 2 months, but we haven't made much progress so far, as she's proven to be quite a unique patient. We don't get a lot of patients that have an animal personality. The method we've been using so far is called psychotherapy. This is a very common type of therapy used to get down to the drives of the patient and the root of the problem. So far, this has not been very effective. You see, the goal of the therapy is to get to know the alters. This is what we call the other personalities. To get to know them on a personal level and try to identify what the reason for the split identity is. Usually, it's because of a traumatic experience in the patient's past, like physical or sexual abuse. But with this patient, it has not been working so well, as the patient's alter is a cat, and as we all are well aware, cats cannot speak. But for the time being, we will continue to use the current treatment and hope for progress. So Sandra, how's the week been going for you so far?
To be honest, I can't really remember much, but I don't think anything drastic has happened. My mom said that I switched between personalities again and that I was acting like a cat, but I don't remember it at all.
Well, you know by now that that's normal for your condition, but I was asking more of how you feel right now.
Right now, I'm feeling really depressed and guilty all the time, and I don't know why. It's whenever I'm in my primary personality that you told me about that I'm feeling like this, and my mom's told me that I'm not really acting like myself. Like, I'm acting mopey all the time. Like, I don't want to do anything.
Well, the main thing we need to try to focus on right now, Sandra, is to try to find some sort of event that may have happened in your childhood that you repressed. So I'm going to need you to work with me, and so far, the method of treatment we've been using has not been working. I've talked to your mother, and she says this is fine, but I want to run the new method by you.
That's fine, whatever will help me.
As of right now, I think our best option for treatment is hypnosis. Do you feel comfortable with that?
That's fine, like I said, whatever's going to help me.
Okay, I'm going to ask you to come back here at the same time next week so we can start our new method of treatment. Sound good?
Okay, I'll see you next week, Dr. Andrews.
Sandra, moping around isn't going to solve anything. We need to go out.
Mom, I don't want to go.
You know what? We're going to go. We're leaving in 15 minutes. We're going to go to lunch. Get ready. Oh no, not again. No, not again. We went to therapy. This happens so often, I'm starting to worry about her. She's my little girl, and I never expected this to happen to her. I've been trying to think of traumatic experiences she may have suffered when she was a child, but I can't remember anything specific. Oh my God, I know exactly what happened. When she was little, one of her neighborhood boys, a real menace he was, he took her cat and beat the poor thing to death in front of her. She wouldn't speak for weeks, and she really never was the same playful kid she was before that. That's what may have caused all of this.
La 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 la, I love my kitty. La la la. Oh no. Oh no! No!
Hi Sandra, are you ready to start our new treatment?
Hi, Dr. Andrews. I'm ready.
Alright, I'm going to ask you to sit in this chair right here, and we'll begin shortly. Okay, I'm going to ask you to stare straight ahead
Alright.
while I wave this in front of you. Okay, Sandra, what was your cat's name?
Fluffy.
May I speak with Fluffy now?
Meow.
After many weeks of hypnosis therapy by Dr. Anders, Sandra has been having fewer and fewer changes in identity. Dr. Anders speaks with Fluffy and Sandra under the hypnotic state about the traumatic experience and works on reintegrating Sandra's identities. Since starting hypnosis with Dr. Anders, Sandra has gotten a lot better. I feel like I finally have my little girl back again. She's now active in clubs, at school, and is even thinking about becoming a vet when she gets older.
Hey, Sandra.
Hey.
Want me to get your instrument?
Yeah, thanks.
Did you sleep good?
Yeah. I got a full night's rest finally.
That's nice. Took me a while to get to sleep, but
Sorry.
it's all good. I'll put your instrument in the back.
Thank you.
My mom said this stuff's really good at home.
Okay. Alright, we have to go get dog food.
Okay.
Oh, and I think we have to get cat food too.
Okay.
Hey, Brittany, I think I found out a dog food. Here. This is what we have to get.
What kind of cat food should we get?
Oh, we don't need cat food. I just realized we don't even have a cat.
Oh. Okay, you wanna go get the ice cream then?
Yeah.
Alright.
I feel
feeling so happy now.
Sandra is now participating in sports and clubs at school and is feeling less and less depressed. She has also stopped drinking alcohol and now frequently goes out with her mother to eat without having episodes. Thank you for watching True Life. I have dissociative identity disorder.